Good evening. This is a presentation on schizophrenia by Kaylee Minarski. Defining schizophrenia. Schizophrenia is a mental health diagnosis in which it affects how a person thinks, feels, and behaves. People with this disorder may seem like they have lost touch with reality. Schizophrenia presents itself in a multitude of ways to include positive, negative symptoms, and cognitive symptoms. So symptoms of the disorder. As mentioned above, positive symptoms are characteristics or traits added to the person because of the diagnosis. These include hallucinations, delusions, a thought disorder, or movement disorder. So an example of the thought disorder would be somebody might think that banana equals 7, and while that doesn't make sense to us, in their mind that does make sense, and their ability to reason is no longer there. Negative symptoms, characteristics or traits lost. This includes a flat affect, so monotone, really no facial expression or voice tone when they're talking. Reduced feelings of pleasure in everyday life outside of your normal diagnosis of depression. And difficulty beginning and sustaining activities, as well as reduced speaking. The cognitive symptoms of the disorder include poor executive functioning, slight ability to reason with right and wrong, have impulse control, recall memory, that goes out the window. There's trouble focusing or paying attention, and there's problems with working memory, as mentioned, so the ability to use information immediately after learning it. So how do the neurotransmitters in schizophrenia, how are they connected? So research suggests that schizophrenia may be caused by a change in the level of two neurotransmitters, dopamine and serotonin. And a study indicates an imbalance between the two may be the basis of the problem. So this was found out by when medication was given and it used or affected the dopamine and serotonin transmitters, there was a noticeable change in the patients. And so they realized, okay, so if we use this medication and it's affecting these neurotransmitters, that must be helping. So if we don't use it, then that must be causing it. The majority of drugs used to treat schizophrenia include antipsychotics, and these are to help alleviate some of the more severe symptoms. And however, other drugs like anti-anxiety and the SSRIs can be used to deal with the comorbidities of depression and anxiety. So the benefits of using drugs is that, according to one source, drugs are the cornerstone of treatment for this disorder because of the chemical imbalance of the brain. Not using medication to treat the disorder would do a disservice to the patient. The medication used would either be a first or second generation antipsychotic. The second generation antipsychotic have more or less severe side effects, so dyskartesia and stuff like that is not as prevalent in the second generation psychotics. And it helps with some sort of the severe symptoms, hallucinations, feeling out of touch with reality. By not using medication with these symptoms, they would be ever present and they would interfere more with daily function. Additional information is that schizophrenia is a lifelong disorder. There is no spontaneous recovery. It cannot be cured. However, it can be treated. It requires medication and therapy. However, some people choose to do just the medication route. In addition, the mortality rate of schizophrenia is brought on by suicide. The disorder itself, so schizophrenia doesn't cause death, but schizophrenia causes suicide ideation and suicide attempts as well as suicide successes. So that is what the main cause and mortality rate of the disorder is. And here are my references. Thank you.